Hello, good evening. This is Avneet, and today I'm gonna introduce about the project about the personalization of monitoring system parameters to support ambulatory care for dementia patients. And dementia is a chronic or progressive syndrome characterized by deterioration in memory, thinking, behavior, and ability to perform daily activities. It has some signs and symptoms. Early signs are characterized by memory loss, difficulty in right words or understanding the conversation, confusion, especially when seeing the familiar places, changes in mood or personality, for example, apathy and depression. Struggle with complex tasks or problem solving assessments, losing interest in activities or hobbies which the person usually used to like. There are some late and or moderate symptoms which are increased memory loss and confusion, trouble recognizing family or friends, difficulty with coordination and motor functions, sleep disturbances, hallucinations or delusions. Even dementia has common types. The most common form of dementia is the Alzheimer's disease. The next is vascular dementia, Lewy body dementia, frontal temporal dementia, and the mixed dementia, which is the combination of two or more types of dementia. Dementia has treatments, but there is no cure of dementia. But the treatment includes some kind of medications and therapies. Medications, for examples, given to the Alzheimer patients, that is cholinesterase inhibitors, memetamine, for the patients in the suffering from anxiety, depression, and sleep disorders. There are some therapies: cognitive stimulation therapy, occupational therapy, music, and art therapy. And the people must should change their lifestyles and should need a support from caregivers. One of the famous personality which suffered dementia was Bruce Williams. And the motivation why are we doing this presentation is the prevalence of dementia, which causes the unusual behavior and cognitive decline, is high and affecting million of people worldwide. About the care challenges, the conventional in-person monitoring is required, but uh, is required a lot of resources and could miss shift in behavior in real time. The need for customizing solution originates from the possibility that standard monitoring systems fail to take into account. Now, my batchmate Aman is going to explain about the next slide.
About problem definition and what is the issues here. What are we sensing? We are tracking things like their activity level, their heart rate, how they move around, and their location. What are the challenges? Different behaviors. Every person is different. Some walk a lot while others they stay still. Some might even wander off, which is risky. One system may not work for everyone. Small changes are hard to detect. If someone's condition changes just a little, it might not be noticed by the sensors unless they are set very carefully, alerting at the right time. We want the system to send alerts when something is wrong, but we don't want too many alerts that turn out to be naughty. In simple terms, we are using sensors to watch people's health and safety, but it's tricky because everyone is different. Some problems are hard to catch, and we need to send alerts only when really needed. Now, Sandeep is going to present the next part.
Datasets and features, present scripts. On this slide, we are discussing the types of data used and key features extracted from that data. The information used is gathered from the information two main sources: environmental sensors like motion and door sensor. Second one is wearable devices such as those with acceleration and GPS sensors. These devices collect data on things like how fast a person walks and how often they visit the bathroom, how frequently they change rooms, and last one is and other specific behavior related to the patient. From this data, we identify important features including like as activity trends over time, the number of steps taken, the amount of time spent in different rooms. And the last one is the unusual or odd movement that might signal health outcomes and concerns. These features are crucial in helping monitor a person's daily routine and detect any early signs of health decline. The next part is discussed by my team member Damanpreet.
About the in the monitoring of dementia patients, there are plenty of sensors that are used to track health, behavior, and locations in safety. These sensors had provide continuous and real-time monitoring, which is I think essential for the managing dementia care patients. And there are some kind of categories and examples of sensors that I'm gonna discuss, like motion and activity sensors, which includes accelerometers, gyroscopes, which track walking and also the rotation of the person. And if I talk about the location and tracking sensors, there are sensors like GPS trackers. Mainly, they are used in watches as well as the pendants also. Now I'm going to talk about physiological sensors like heart rate monitors, respiratory sensors, and which are used to measure pulse rate as well as the breathing rate of the patient. And also there is a temperature sensors, how to we can monitor temperature of the patient's body. And there are environmental and safety sensors also, like window sensors, stove and or appliance sensors that are used to monitor the to prevent accidents in the kitchens as well as to trigger the patient try to leave unusual times. Vision and audio sensors are also made a great impact in the dementia care patients, because the cameras and microphones that we usually use in our daily lives to detect falls as well as to monitor the visuals of the patient. There are some wearable and smart devices like smart watches and bands that are mostly used by the athletes and the fitness freaks, but they make a major impact on the dementia care patients to detect their heart rate monitors in their daily life. And why we choose the sensors? The continuous data source that is non-instructive to detect, and there are personalized setting modifications to this thresholds such as idealization and according to the patient personal patient history. As the time goes on, patient behavior may change according to their medications and the machine learning models to change. These are really important to take that how to detect the sensors in dementia patients. And the next slide would be discussed by the my group member Priya.
Let's I talk about the assessment and results from sensors used in the dementia patients: accuracy, false alarm rate, and sensitivity, identifying actual occurrence. Motion sensors, passive infrared assessment, monitor movement patterns in the home, walking, sleep, wake cycles, and washroom. Results: studies show altered activity patterns, frequent night wandering can be early indicators of cognitive decline. Wearable sensors, gyroscopes, assessment track gained, balance, tremors, falls, and location, assess mobility, falls risk, and wandering behavior. And the results: abnormal gain patterns, shorter stride, slower speed are linked with Alzheimer progression. Vital signs, sensors, heart rate, respiration, temperature, and the assessment monitor heart rate variability, respiration rate, and skin temperature, can detect signs of stress, agitation, or sleep issues. And the results: fluctuations in heart rate and sleep patterns correlate with behavioral and psychological symptoms of dementia. Pressure sensors, bed, chair, or floor mats. Assessment detect presence or absence, getting out of bed or chair. Monitor sleep duration, restlessness, or falls. Results help predict nighttime wandering or agitation. A study in long-term care showed early detection of bed exit, reduced nighttime falls by over 30%, and voice and sound sensors assessment monitors speech patterns and detect distress calls, and results reduce verbal fluency and increased pause length are linked to mild cognitive impairment. After that, the conclusion personalized systems increased detection accuracy and reduced false alarms, eliminated needless interventions, and enhanced caregivers' response as systems learn patient behaviors and they become more reliable. Moving toward the next slide, key takeaways and conclusion. Findings monitoring is less disruptive and more accurate when it is personalized. Promotes independent living while maintaining security. Filters unnecessary warning, reducing the effort for caregivers, and the restrictions, initial calibrations, and continuous upgrades are necessary. Privacy issues, particularly when it comes to tracking behavior or locations. Moving towards the conclusion of the presentation, ultimately a practical step toward more intelligent and efficient dementia care in both home and communities. Setting is personalized monitoring parameters. I hope my presentation is helpful. Thank you.